بسم الله الرحمن الرحيم. Assalamu alaikum everyone. I hope all of you are doing well, succeeding and achieving your goals. Today I'm going to talk, as I promised you before, I'm going to talk about the final exam a little bit because I see that many of you have some anxieties about the exam, and you really shouldn't. If you study the material, there are no tricky questions. The questions are straightforward. If you know the material, you will know how to answer the questions. So let me start with this topic, which is examples of the final exam questions. So the first section of the exam will have multiple choice questions, which means, as you all know, a question that has different choices, and you will need to choose one of the choices. I have a question here for you as an example. Researchers investigating risk factors for falls statistically compared a group of elderly subjects who had fallen in the previous year to a group of elderly subjects who had not fallen. Which of the following is the correct research design for this study? Okay, all of you have read articles and all of you have summarized the article and tried to understand how the article is written. This is an experiment that was published in a journal, and in this experiment the authors or the researchers have compared elderly people who have fallen the previous year and a group of elderly people who have not fallen the previous year. Would you say that this study is a case-controlled study? Would you say that this study is a cohort study, experimental study, or qualitative study? I'm sure those of you who are reading the material and who are reading the slides every week, I'm sure you can answer this question very easily. It's a straightforward question. There is a definition of case-controlled studies, a definition of cohort study, a definition of experimental study, and you know what a qualitative study is. So I'm sure you can answer this question. Let me give you another example. Evidence-based physical therapist practice is characterized by which of the following? This question is really from the material that is presented in the very beginning. It was talking about evidence-based practice in general. So when you say that physical therapists are practicing according to evidence, what are the characteristics of this practice? Does this mean that there is a reliance on practice habits established by tradition? Is it secondary consideration of patient preference? Formation of a question on which to base an evidence search? An emphasis on the practice experience of the individual facility. Facility here means institution, means المستشفى, clinic, whatever. All right, so which answer would be the correct answer? Of course, I'm not going to give you the answer because who knows? Maybe this question will appear magically on the final exam. So I don't want to give you the answers to these questions. Which of the following biomedical search engines اللي هم databases, how to search in a database, right? So, which of the following biomedical search engines limits citations to randomized trials? Now we know what randomized trials are. Systematic reviews and practice guidelines. Again, which of the following biomedical search engines limits citations means they only give you studies that are dealing with studies that are done on randomized trials, systematic reviews, and practice guidelines. Is it PubMed, CINAHL, Cochrane Library, or Pedro? which one will include only studies that are randomized studies, systematic reviews, and practice guidelines. All right? So that's another easy question. If you go look at the slides, you'll know the answer right away. One more. Which of the following is an example of a background question? Remember that when we did the PICO before, we did how to ask a question for a clinical information. We said that we can ask a question about outcome measures. We can ask question about outcomes. We can ask questions about different interventions. We also can ask a background question. I get a patient in the clinic and then I want to know something about the background of his condition. So which of these questions would be considered a background question? Please pay attention to the words in the questions. I'm trying to use the pointer. Okay. So background question. I didn't want to do it with red, but that's what I got. Okay. Background question. This is different from an intervention question or an outcome measures question and so on. Sorry about this mess, but all right. Does the Berg balance test accurately classify fall risk in an 85-year-old woman with hemiparesis following an acute stroke? So if you have a question about the appropriateness of using Berg balance scale or Berg balance test to classify fall risk in a woman with hemiparesis, pay attention. This is not a question about Berg balance scale or Berg balance test. This is not a question about the test. It is a question about the question, meaning that the question is asking you which of these questions are considered a background question. Every one of those questions are good questions, are legitimate questions, are appropriate to ask, but not all of them are background questions. So you need to pay attention to how the question is written. Okay? All right, so the first one was asking about the Berg balance scale. Is a daily application of wet to dry dressing effective for healing a traumatically acquired partial thickness wound in a 46-year-old male? So it's a type of dressing. It's a question about type of dressing, if it is appropriate for someone who has a wound and it is partial thickness wound and the patient is a man who is 46-year-old. All right. The following question: Will a general questionnaire identify functional deficiencies in a 23-year-old woman with multiple sclerosis as accurately as a condition-specific questionnaire? So this question is asking about two types of questionnaire. One is a general questionnaire. The other is a condition-specific questionnaire, and it's asking which one is better in identifying functional deficiencies. All right. The following question: How does a beta blocker, you all know beta blockers, these are a class of medicine that is used a lot in many patients, especially patients with hypertension. So how does a beta blocker improve exercise tolerance in a 52-year-old man following an acute myocardial infarction? So this question is asking about a specific class of medication. It's called beta blockers and or beta blocker and its effectiveness in increasing exercise tolerance. So this is another type of question. It's multiple choice question, but as you can see, the choices are not very small. They're not very short. They're not just one word. The questions are, the options are long. So on this question, you really need to pay attention and read every word. You can't read half sentence and answer the question. All right? Okay, another type of questions, it is terms definition. So the question is trying to test your ability to know the definition of some terms. This is an example. The end results of patient-client management, which include the impact of physical therapy interventions, may be measured by the physical therapist or determined by self-report from the patient or client. This is true, that the end result could be determined by self-report from a patient or client. This statement, is it talking about outcome measures? Is it talking about goals? Is it talking about outcomes? Or is it describing examination? So which one of these words would be defined as the end results of patient and client management? And the rest of the sentence. Okay, I hope this is clear. So the words are the choices. The definition is the beginning of the question. So to answer this, you need to look at these words and see which one is defined by the statement above. Okay, this might be a little more difficult than the previous one, but I am going to include the definitions that are obvious. So I think this question is obvious because we're talking about the end results of patient and client management, which describes the impact of physical therapy intervention. So it is obvious that this is, I'm not going to say, but I think it's obvious. Okay, so this is another type of questions that could be asked on the final exam. Another thing on the final exam, you might see case scenarios, which means just a patient scenario, a patient story. So let's look at this story. CY, and we do this with patients because we don't want to spell out their names because of patient privacy, that we should not talk about patients or about their condition with anyone. And we should never reveal the identity of the patient. Even if the patient is a relative of someone you know, you are not supposed to talk about patients without their permission and without their consent. So this is something that we in here cannot do and can get punished really badly if we do, because the patient can file a lawsuit because you have invaded their privacy, you have revealed this, personal questions about personal information about them. So we are not allowed to talk about patients in the elevators, in the street, with the relatives, with anyone. We can talk about patients in the professional setting with other colleagues, but we all must protect the privacy of the patient. So this is a patient, CY, which is abbreviation of his first and last name, is a 30-year-old female, a woman, who was first seen by a physical therapist on June 1, 2003, with a complaint of right shoulder pain. So this patient has right shoulder pain. This pain is worse with overhead reaching, and her pain score is 8 out of 10. So on the visual analog scale, her pain is 8 out of 10, which is really, she is in a lot of pain. So when she does anything overhead, when she raises her arm, her pain is 8 over 10. Best condition when she supports her arm, so with supported rest, so when she supports her arm and rested, the pain is 2 out of 10, which is very minimal pain. When reaching meaning that she's getting something from the cupboard, she's reaching for the sugar or for the tea or whatever, she describes the pain as sharp, and she says it feels squishy. She's describing the type of pain she's having. Rest and Tylenol relieve but do not eliminate the pain. So when she rests, when she takes Tylenol, which is like Panadol or whatever, she feels better. But as you can see, she has a problem with overhead activity. She has a problem with reaching. When I have a scenario like this on the final exam, I'm not going to ask you a question about shoulder conditions. I'm not going to ask you what are the tests you're going to do and how you're going to treat this patient, or what do you think the diagnosis would be. We're not going to do any of this. My question is going to be about how to find the evidence about this condition. So the questions about how to find the evidence, but not about how to treat the patient. So don't worry about any questions that are talking about special tests like the empty can test or this test or that test. Don't worry about questions related to any rotator cuff tear or any of that. The question will be about what we talked about, which is evidence, not about the condition. So that's another type of questions that you might see on the final exam. So this, I will stop here, I think, about questions, but every time if something comes up, I will give you examples. Please look at these examples and see if you can answer the questions, and try to pay attention to everything in the question. Don't read half of the sentence and think that you know the answer already. Okay? Good luck to you. I will keep talking about the final exam, and you can ask me questions as well about the exam. Another type of questions, I'll prepare some other questions for you next time, which is the true-false questions. I'll give you some statements and tell you if it's true or false. I'll prepare some for you next time. So every time I'll try to share with you some of the questions, not the questions that will be on the exam, but the type of questions that might be asked, because I want to alleviate your anxiety about the test. You should not be afraid of the test. It's straightforward. It's asking about the material. If you know the material, you don't need to worry about the test. All right? So let's start our lecture for today. Remember, when you read the article, when you did assignment 1B, you read an article, and then there was a question that I asked you about the research subjects. Many of you told me, gave me good information about the subjects, and many of you did not answer the question, how did they recruit the subjects? I think more than half of you did not answer that question. I did not deduct points because this is something that I did not teach yet. So if I didn't teach it, I don't deduct points. But after today's lecture, if I ask you what was the method of recruitment, you should know, because we're going to talk about it. All right? So research subjects, when you read an article, it's very important to read about the research subjects, because research subjects will tell you what is the study population. Study population, it means the people that will be affected by the study. The specific people who will benefit from the study is called the target population. Target population are all individuals in the world, in the whole wide world, who will benefit from the results of the study. So if I'm doing a study on older adults with osteoarthritis, then the results of the study should benefit everyone in the world who has osteoarthritis. If I'm doing a study on children with Down syndrome, then the target population of my research is children with Down syndrome. Athletes after anterior cruciate ligament reconstruction. So again, my target population are these athletes. I will not be able, obviously, as you all know, I will not be able to test every child in the world with Down syndrome. I will not be able to test every single older adult in the world with osteoarthritis. So researchers usually, actually all the time, cannot do the study on all individuals in the target population. So the target population are the people who will benefit from the results of the study, but not necessarily the people that you will do the research on. We have accessible population. The accessible population are the people who are accessible to us, the people that we can reach, the people that we can recruit from. It could be, for example, if one of you is working in Al-Qasr Al-Aini, then this is accessible population for this person. If you're doing a study on, for example, a stroke, people 2 weeks after stroke, then your accessible population is every patient in Al-Qasr Al-Aini hospital who had a stroke 2 weeks ago. So that would be accessible population. Why? Because you can access these people. Again, you're not going to be able to do your study on every single patient who had a stroke 2 weeks ago in Al-Qasr Al-Aini hospital. Al-Qasr Al-Aini hospital is huge. You're not going to be able to test every single patient after stroke in this huge hospital. Sometimes the accessible population could be a specific city. If I want to know, for example, what is the rate of scoliosis in Cairo, in idiopathic scoliosis in school children in Cairo, that's accessible population if I live in Cairo. But definitely, I'm not going to be able to test every single child in every single school in Cairo. So although theoretically, nazariyan, it is an accessible population, but researchers do not do studies on every person in the accessible population. Researchers do a sample. The sample are the subjects who will participate in the study. So there is a target population. From the target population, there is an accessible population. From the accessible population, you take a sample. How do you take the sample? How would I choose people to participate in a study? Actually, it depends on the study design. The study design identifies the potential candidates for the study, the selection of appropriate number of individuals from the candidate pool. So the candidate pool, again, is accessible. I have, for example, if I want to do a study on your program, on the DPT program, I have a huge pool of students, but then I can select the appropriate number that will benefit me in the study, and that will be determined by the study design. Management of the subject's role and activity during the study also is determined by the study design. So the sample, what's going to happen to these subjects, how many subjects, males or females, everything about the subjects will be determined by the study design. Subject identification in every study, and many of you did a wonderful job in listing the inclusion and exclusion criteria, and that was very good. One of the strongest things that many of you did in the assignment. Inclusion criteria, the things that subjects must have to be eligible for the study. For example, individuals with spinal cord injury who were at least, this is according to this study by Ho. He did a study, and one of the inclusion criteria was individuals with a spinal cord injury who were at least 18 years old and who had stage 3 or 4 pressure ulcers, دول عندهم bed sores or pressure ulcers, with clinically clean wound beds. Okay, so he determined for the study that he wants people who had spinal cord injury, who are at least 18 years, so he didn't want anybody to be, for example, 17 or 16 or 15, and he wanted people with wounds, pressure ulcers. The pressure ulcers had to be stage 3 or stage 4 with clinically clean wound. The clinically clean is between quotation marks. It has a specific definition because this author wanted to avoid people who had any necrosis or any bacteria in the wound. Okay? So that's one of the inclusion criteria. In this study, for example, people with Parkinson's disease who were managed at a movement disorder clinic in Hong Kong. So he decided that he's going to test people only in Hong Kong. And in this lab or this institution, which is the movement disorder clinic, they were able on their medical regimen and were able to rise to standing. They were stable on their medical regimen. Stable meaning that they don't have abnormal heart condition, unstable heart condition, or unstable neurological condition, something that can cause problems during the treatment. Okay, and we're able to rise to standing independently. They can go up from sitting to standing independently. What do you think of these inclusion criteria? Well, as you can see, it limits the population or the sample with several criteria. Is this a good thing or a bad thing? It is a good thing because if you don't do this, you're going to have a salad ball. You're going to have people who might respond to the treatment and people who might not respond to the treatment depending on their condition. So you're not going to be able at the end to say, well, my treatment was effective, because you have people who have different characteristics, and some people might respond and some people might not respond. It might be bad sometimes or limited sometimes, because if I have stage 3 or 4 pressure ulcers with clinically clean wounds, then I have an easy way, because this specific study was done on pulsatile lavage for pressure sores. So it is a type of lavage that is done for pressure, to treat pressure sores. So if I'm taking people with clinically clean wound, so maybe I'm biasing my study in favor of positive results, because the effect is going to be good, because these people have stages 3 or 4 pressure ulcers with clinically clean wound. They don't have any complications, so they might actually recover on their own without my treatment. So pay attention to the inclusion and exclusion criteria and see if the authors had to do this, or the authors are biasing their results. Exclusion criteria, obviously, the persons who will be excluded from the study, you tell them, I'm sorry, I cannot include you in the study. One of the common exclusion criteria that we do in research all the time is people who are not able to follow instructions, because our interventions are usually exercise interventions, are usually asking people how they feel. If people are not, they have a mental illness, or they have a condition that interferes with them understanding you and following directions, then it is hard to capture the results and to actually apply the intervention. So in many studies, you will see that people who are not able to follow instructions are excluded. But also, like we exclude all the time anybody with unstable heart condition, anybody with unstable neurological condition, anybody who is, for example, who can't see in my balance research, it is hard for me to conduct group intervention if someone is not able to see or hear or follow instructions. So when you read articles, I know that you are not going to do research, or maybe you will, but at least for the purpose of this class, what my goal is for you to understand the articles when you read them. So when you read the section on subjects, pay attention to the inclusion and exclusion criteria, because this is the only way you can apply the results on the target population. So from this, for example, if I have a person with wound necrosis, if I have a person who is at least 18-year-old and he had stage 3 or 4 pressure ulcer, but then he has necrosis in his pressure ulcer, then I cannot take the results of this study and apply it on the other patient. Okay? So inclusion, exclusion criteria are important to pay attention to and to understand. How do I select the subjects, or how do researchers select the subjects? The best way to select subjects is the probabilistic sampling. Probabilistic sampling means I randomly select people for the study. I don't choose people. I select people randomly. Randomly, let me give you an example. If I want to know your satisfaction about the DPT program that you're going through. So if, for example, you are, I think you are 200 students, or about 200 students, then I will say that student number 1, number 5, number 10, number 15 on the list is going to be in my study. I'm going to give you a survey and I want you to answer a question. So, or I can put numbers on papers from 1 to 200 and put them in a hat or in a bucket and ask someone, preferably a child, to pick the numbers. So he might pick number 16, number 100, number 75. So these are random numbers. This is a very simple way. There are other ways that are more sophisticated, and that's by using computer-generated numbers. And both of them are great. Both of them are random. Both of them can give me a random sample. Could this method have sampling error? Well, maybe and maybe not. The chance of sampling error in this design is small, because if I follow directions, if I actually take your names or your numbers and put it in a hat or in a basket and get someone to pick from these numbers, then this is very random. This is the best way to select sample for the research, but it is not easy because you don't have everybody in the beginning. I don't have 200 people after a stroke to actually randomly select for my study. So most research you will see non-probabilistic sampling. So this does not involve a random selection. It is not random, but this is the most commonly used in clinical research because it is easier to implement. It increases the probability of sampling error because you are not doing this randomly. The most common is referred to as convenience sampling or sampling by convenience. It means it is the best way that I can do in my practice. Recruit easily available subjects who meet the criteria for the study. So how do I recruit people? I can put flyers. So I target, for example, in Al Asr Al Aini Hospital or in Mabarra Hospital or any hospital, I put flyers saying that I'm going to do this study. Please come and participate. And that's true of clinics, medical centers, or for example, if I'm doing a study on you as students, I can put something on my Facebook page, which I don't use, but anyway, I can put it on the course, and I say I'm doing a study, I'm gonna have you answer a survey, and on this I would like some students to participate. So some students might participate and some students might not. Now, this method is problematic because it can bias the study. For example, if I'm going to say, I'm going to do a survey about my class, so I would like some students to participate. This can bias the results because students who are doing well in the class may be the ones who would like to participate, or maybe students who are not doing well in the class would like to participate. So I might get mostly top students, or I get mostly the students who are not happy with the class. So this can bias the results. Also, this might introduce dissimilarities between the individuals who volunteer and those who do not. So if, for example, I'm doing a study about the DPT, people who are happy with the DPT can participate in the study, and maybe people who are not happy with the DPT will not participate in the study. So now I cannot say that the results will be representing everybody, right? Within the study, if the study is experimental, meaning we have group comparisons, then group assignment can be random. Random assignment is the best, that you have equal number of people in each group. When groups are equal, this is called a balanced design. The randomized process again increase the chance of achieving group equality. If I don't do it randomly, then I can bias the results. So subject management within the study, if it is experimental, meaning I'm going to have experimental group and control group, then it is best if I have the same number, 10 and 10 or 20 and 20 and so on. They need to be equal, and I cannot choose. I say Ahmed is going to be in the experimental group and Fadi is going to be in the control group. I cannot do that. I have to randomly assign them to get the best results. It's not, so that study is not biased. The random assignment, how to assign randomly? Again, pull from a hat or from a basket the patient name or number, or with a coin, ملك ولا كتابة, or صورة ولا كتابة, or whatever it's called, and you put people randomly like this. There is something called the block assignment, and that is when you assign identified number. For example, I get the people I have. I'll show you this in a graph in just a second. I have patient A, patient B, patient C, patient D. And then I have 4 groups. So patient A is going to go to group 1, patient B is going to go to group 2, patient C is going to go to group 3, patient D is going to go to group 4. So you keep doing that. Every patient comes in, you assign him to the appropriate group. Sometimes researchers do something called matched assignment. So you have 2 groups and you have 4 women and 10 men in the group. So I don't want to divide the group so the 4 women would be in one group and not in the other. So in this case, you try to match. You put 2 women in this group and 2 women in this group. Also, if you have, and this is done when you have a condition that is not very common. If you are studying a rare genetic disorder, you want to make sure that your groups are matched because you don't have a lot of people with this rare disorder. Okay? So I can match, for example, if I have, again, 6 older individuals and the rest of the individuals are young people. So I don't want to put the 6 older individuals in one group. I want the 2 groups to look like each other. So I'm going to divide them between the groups. So this is the match design. This is the block assignment that I was talking about. So subject A is going to group. So these are the subjects before I do groups. These are the subjects A, B, C, D, E, F, G. Then subject A is going to go to group 1, subject B is going to go to group 2, subject C is going to go to group 3, and D to group 4. E is going to go back to group 1, F is going to go to group 2, and so on. This is the block assignment. So as you can see that we do a lot of things to try not to bias our results by choosing subjects. Sometimes there is a non-random assignment because it doesn't make sense that we randomly assign people. For example, in this study, they put people with chronic low back pain combined with widespread musculoskeletal pain in one group, people with chronic pain or chronic low back pain only, no other pain, in another group, people who were pain-free without a history of musculoskeletal problems. So you can't randomly assign these people. You want the people with low back pain only in one group, people with back pain with other things in one group, and you want people without pain in a third group. You can't mix those groups. So you can't do it randomly. For example, for my research, I always divide people into fallers and non-fallers. You can't mix people. You need to see if fallers will respond to the treatment as well as non-fallers. So lack of randomization reduces the likelihood that groups will be equal in size, because I am not sure that I'm going to get 10 fallers and 10 non-fallers. I'm not sure I'm going to get 10 chronic low back pain people with musculoskeletal pain and 10 people with pain only. So sometimes it's not equal in size or distribution of characters. So these are the drawbacks of non-random assignment. By the way, since we're talking about the final exam, this is a good question to ask. If I have a non-random assignment, what are the disadvantages of that? So, or random assignment, what are the advantages of random assignment? So these are good questions for the exam. How many people? Sample size. Sample size is a huge topic. Do I test 50 people, 10 people, 500 people? Well, this is a good question that doesn't have a simple answer. The answer to that question, you will have to say it depends. It depends what you are studying, and it depends on the effect that you want to see, which is the effect size. So when we say a sample size, we are talking about n. It's referred to as n. N for number. So n equal 50 means I have tested 50 people. N equals 10 means I have tested 10 people. The minimum number of subjects required to ensure the important relationship between variables can be detected statistically, and this is called the power test. For example, before I do the study, I can do a statistical test that is called the power test. The power test will determine how many subjects I need for the study. For PhD students, for people who are doing research, they know how to do this, but I just want you to know that the bigger the sample size, the stronger the results. If I'm going to do a study on 2 people, I cannot really say much about the population. Remember, we're trying to get results that affect many people, the target population. But if I'm going to test 2 people, for example, if I take 2 people from your class and ask them a question or give them a test, I cannot say that these 2 people represent the whole class. Maybe these 2 people are the best students in the class, and maybe these 2 people are the people who are not doing well in the class. So when I take 2 students from 200 students and give them a survey or give them a test and say, these 2 people are going to give me the results that I can make inference about the whole class, then that is not realistic, that is not right, that's not representative. Remember, our goal is to have a sample that is representing the target population. If it is not representative of the target population, then it is really very limited. So this whole lecture is about how the subjects for the study can be chosen, can be recruited, and what are the methods that we can use to decrease the bias and to have results that can be applied to the largest target population. Okay? All right. This is the end of it. Good luck to you and looking forward to seeing you or talking to you next week. Feel free to email me with your questions. Assalamu alaikum.